welcome to the 2021 Virtual CHW Summit. We'll start in just a couple of minutes.
Hey, feeling good, like I should. When in dark, walk around the neighborhood. Feeling blessed, never stressed. Got that sunshine on my Sunday best. Yeah, hey, every day can be a better day despite the challenge. All you gotta do is leave it better than you found it. It's gonna get difficult to stand, but hold your balance. I just say whatever, cause there is no way you're round it. Everyone falls down sometime, but you just gotta know it'll all be fine. It's okay. It's okay. It's okay. Hey, feeling good, like I should. When in dark, walk around the neighborhood. Feeling blessed, never stressed. Got that sunshine on my Sunday best. Hey, some days you wake up and nothing works, you feel surrounded. Gotta give your feet some gravity to get you grounded. Keep good things inside your ears just like the waves and sound it. And just say whatever, cause there is no way you're grounded. Everyone falls down sometime, but you just gotta know it'll all be fine. It's okay. It's okay. It's okay. Hey, feeling good, like I should. When in dark, walk around the neighborhood. Feeling blessed, never stressed. Got that sunshine on my Sunday best. Hey, feeling good, like I should. When in dark, walk around the neighborhood. Feeling blessed, never stressed. Got that sunshine on my Sunday best.
Hello and welcome to the 2021 Virtual CHW Summit. I am so glad that you are here and you've chosen to spend this time with us this week. The theme of the summit this year is elevating the multi-dimensional skill set of community health workers. Before I introduce our dynamic speaker for the hour, I would like to go over some housekeeping items. We'll be using the chat box featured throughout the session today, and to use the chat box, you'll need to click on the chat icon at the bottom of your screen. Once the chat box opens for you, there's a drop down at the top of the chat box. Check and make sure when you are sending messages, you are sending messages to everyone and not just the presenter. We will also, no live polls, I'm sorry. We're going to be using another live polling platform, but it will take place outside of the Zoom platform. Today's slides and any additional resources pertaining to this presentation will be made available to you, but they will be made available to you after the presentation. They will be available inside of the Thinkific platform later today. I appreciate your patience in navigating the Thinkific platform course player. It does take some getting used to, but by tomorrow you should have it down pat. As a reminder, it's really important that you complete the survey about this live presentation and any other recorded presentation that you participate in this week. The surveys are located inside of the Thinkific platforms. You'll be prompted to complete the surveys at the end of each presentation. If you don't get a prompt, which you should, you can still find the survey in the summit outline. Please also complete the survey at the completion of this week. These are very important, and Dumeba Health uses every bit of feedback to help inform future educational events. Just a reminder, this presentation has been approved for continuing education hours. or CHWs, CHW instructors, and certified health education specialists. However, you must complete the summit evaluations by April 23rd, so please do not miss your window. Join us on social media. We'd love for you to engage with us throughout the week. You can find us at Virtual CHW Training, actually, not Summit, on Facebook, and at CHW Summit on Instagram. You can see our hashtags there. We also have a photo booth. We'd love to see your smiling face, your business card, and any other thing you'd like to post there as well. Now, while I'm introducing our keynote presenter of the hour, please use the chat box to let us know who you are, where you are joining from, and what are you most looking forward to this week. Again, thank you for joining. Connect with us, post and engage, and let us know who you are and where you are joining us from this week. And now I would like to introduce our speaker who will be the next voice you'll hear once I introduce her. Dr. Denise Hernandez received her PhD from the College of Architecture, Planning, and Public Affairs in Public and Urban Administration at the University of Texas at Arlington. She earned her Master of Public Health from the Texas A&M School of Public Health and a Bachelor of Science in Allied Health from Texas A&M University. Her research focuses on the incorporation of community health workers to bridge the gap between the patient and healthcare system, as well as CHW workforce development. Her passion for addressing the needs of under-resourced communities has led her to focus on the impact of CHWs in vulnerable populations. Dr. Hernandez is also the founder of the DFW Community Health Worker Association, for which she currently serves as the president on the board of directors. She's also worked as a CHW instructor and a CHW ally for 9 years. Dr. Hernandez currently teaches in the public health program at UTA and continues working to strengthen the support in the CHW workforce through research and policy. And you can all see her beautiful face there. I'm going to go ahead now and give it over to you. So I'm going to stop my share. I think you can take over at this point. You're on mute.
Can you hear me now? Okay, thank you all so much for joining us today. I'm so excited to be able to share this presentation with you. This is the first time I share it, and so I'm so excited, and I look forward to hearing what you think and your feedback. This, I hope to be a very interactive presentation, and so please, I really ask you to engage as much as possible. Again, my name is Denise Hernandez, and the information that I'll be sharing today is actually part of I'm going to set my timer so I'm also respectful of your time. So the information about organizational support I'll be sharing with you today are some of the results from my doctoral dissertation. And so this is the first time I'm sharing this, so I'm very excited. So before I go into the presentation, I want to share first some of the terminology that we hear often, right? So as we all know, there are many terms used to refer to a community health worker. So we know there are promotores de salud, lay health workers, patient educators, navigators, and many other names. But for the purpose of my presentation, I'm going to be using the term CHWs. While we also know that community health worker instructors have different needs than CHWs, I'm also going to include them in the term CHWs. And so just keep that in mind. And then at the same time, we also know that community health worker groups have different names. We hear organizations, networks, associations, coalitions, And so again, for the sake of this presentation, I will be using the term organizations. So when you hear that, I'm referring to all the above. I also like to point out that this research was conducted in Texas with community health workers in Texas. So for those of you who work outside of Texas, some of this may be very applicable to your CHWs as well. And I'd look forward to hearing what some of your experiences have been as well. So to give you a little information about me and how this research came about, as Quisha mentioned, I'm the founder of the Dallas-Fort Worth Community Health Worker Association. We started that development in 2013, and we didn't formally establish the association as a nonprofit until 2015. So it was a long process, a lot of work that went into creating the association. And I currently now serve as the executive director for the organization. I'm also a founding member of the Texas Association for Promotoras and Community Health Workers. And I've worked first as a CHW, then as an instructor and an ally for about a decade now. So in my work, as I was going through establishing these organizations and just working with community health workers, I started asking myself, why are all these organizations different? There's no structure, there's no formal or set method of creating a CHW organization. Why is that? Why are they all so different? Is it because community health workers in Dallas, Texas have different needs than those in Houston and South Texas? And so naturally the organizations would be structured differently? Well, maybe that makes sense, right? That kind of follows the model of community health workers. But do we know that this is true? Do we know that this is why some are informal networks and some are more established 501c3s? Or are we just assuming that? Do we know that community health worker organizations are meeting the needs of their CHWs? Are they conducting evaluations to make sure that the needs are being met? Or even stepping back and looking at the bigger picture, do we know what the needs are of community health workers? Are the needs of CHWs being met? And again, do we even know what those needs are? So then I decided to take all these questions that I had and use them for my dissertation research. Okay, so I shared a little bit about me, and before I go into my actual research and the findings, I want to know a little bit about you. And so I know I can't see your faces, and I know we're using the chat, but we're going to use a live poll using Poll Everywhere. And so if you can, I know everyone probably has their cell phones right next to them. And so if you can pull out your cell phone and start a new text message to the number 37607. And I'm going to do this right along with you so I can see what you're seeing. So 37607. And you're going to text Denise Hernandez 529. And when you do that, you should receive a message that says you've joined Denise Hernandez's session. So I'm going to give you a couple of seconds. Hopefully, let me know if you're not able to join. And I'm also watching the chat, so hopefully you can join. If you have any questions, please let me know. Okay, I see. Okay, good. I see some of you are joining already. Also, if you'd rather do it on, the website, you can also go to this website, pollev.com Denise Hernandez 529, and you can join the live polling there. But if you want to use your cell phone to provide your feedback, text number 37607 and send Denise Hernandez 529 in as a text message. And you'll get a confirmation that you've joined our live poll. Okay, so then the first question, which of the following best describes you? And if you identify as a community health worker, you'll type A. If you identify as an instructor, you'll type B, and you'll send that in a text message. Oh. Okay, try again. It should be. We're seeing some of the results come in. You'll see here on the chart that the results are coming in. Okay, so they seem to have slowed down a bit. So we can see that most of the participants today are community health workers. We have some instructors, but 13% of you so far have identified as none of the above. So that's interesting. And I'll be looking forward to seeing in the chat who you're with. And we have some community health worker allies as well. But again, the majority of you are community health workers. So thank you for sharing. So these are our final results. Okay, so our next question is there a local organization in your region? Again, type A for yes, B for no, and C for not sure. So you can text your response to the same number. And we're seeing the results here. So for the username, you can put your name, or you can make up a username. It's up to you. So if you can see here, 66% of you have said there is an organization, a CHW organization in your region. Few of you are not, or maybe don't know, or are saying no, there's not an organization. And just under 30% of you are not sure if there's an organization. And this is actually not surprising. I think this aligns really well with what I'm about to share. So here are our final results. So thank you all for sharing. Hopefully that's not too complicated. And keep that text handy, because we're going to be sharing some more responses on there as well. And we'll see the live results on the screen. So that's really neat. So for those of you who said there is an organization, are you a member of that organization? So text A for yes, B for no, and C for does not apply. Can you see the results now? I didn't realize I had to click show responses, but hopefully you can see them now. No? Oh, I apologize for that. Yeah, if you go to the website, you can see the live results. So 54% of you said you are a member of your organization, and 27% of you said no. And 18% said does not apply, or 19%. Again, not surprising, and I'm going to share some of my results. Unfortunate you couldn't see that. So let's get back to why it's important to understand whether community health worker organizations are meeting the needs of community health workers. So CHW organizations are community-based professional organizations. And unlike other professional organizations, for example, a nursing association or a National Association for Social Workers, CHW organizations, at least in Texas, range in structure from very informal networks to formal 501c3s. Currently, there's no information available on the effectiveness of these community health worker organizations in providing professional support, or whether membership in an organization is related to whether an individual decides to remain a community health worker, renew their certification for those that offer certification. This is really important because as frontline public health workers, we know community health workers are effective in reaching underserved, vulnerable populations. And even though more professionals are seeing the value of community health workers, especially in this last year, data in Texas shows that there is an increasing turnover rate for both community health workers and instructors. Now, there isn't any direct evidence as to why this is happening. However, there are some needs assessment that have been conducted by organizations that do identify where community health workers feel like they need support. So again, this is from Texas, and in Texas, for those of you that are not from here, every year the Department of State Health Services, the CHW program office, provides a report of the state of the CHW workforce. And this report is these results are from 2019. I'm not sure that the 2021 has been shared yet. It usually comes out around April. So if it's not out yet, it should be any minute now or any day now. But so as you can see on this side-by-side comparison, the number of community health workers has remained pretty steady over the years, right? So the number on the left, that's the number of certified CHWs since 2014. At the end of 2019, there were a total of 4,237 CHWs and instructors. So this only shows you CHWs. And you can see that that's a steady decline. I mean, only 2 less than at the end of 2018, but still, it's still a decrease. And that can be explained, that steady flow can be explained from the renewal rates, the chart on your right. So as you can see, there has been a decrease in renewal rates every year, and which makes sense, right? So even though in 2019, there were almost 900 new community health workers certified, we still saw a decrease. And that's because 982 failed to renew their certification. So we're certifying hundreds of community health workers every year, but we're also losing hundreds of community health workers every year. Similarly, 55 new instructors received their certification in 2019, However, 56 didn't renew. And so there's something's happening. Something's going on where, I mean, it's great. We're training new community health workers, but why are they not renewing? Renewal rates have both, and you can see from this chart here, they seem to have peaked in 2016, and it's just kind of been on a downward trend since then. So why do you think that these renewal rates have decreased? What do you think is happening? And so for those of you who have are using the text feature, if you can text on there why you think community health workers are not. Yeah, or you can share in the chat if you're not seeing the results on here. Right, you can type in, okay, so someone says lack of job opportunities, lack of recognition, underutilized, cost and access. Okay. Are you seeing the screen, the results? So some may progress to become social workers or RNs. That's a, yeah, the cost of certifying, the lack of jobs available, pay rate, that one seems to be a lot, pretty frequent. The pandemic, yes, that definitely affected employment opportunities. Certification, stress. Yeah, great answers. Okay, so I'm not sure why the results are not showing. Can you see them there, maybe? Oh, bummer. Okay. Of course it would work. Okay, not enough support, not enough opportunities, yes. So I think we're all pretty much on the same page as to why this is happening. Much like other professions, community health workers have professional needs too. We can't continue to expect community health workers to give of themselves, their skills, their expertise, if we're not pouring into them as well, right? So my coffee cup needs to be refilled if I expect it to keep giving me the energy to continue working. Many of us have probably heard this saying, you can't pour from an empty cup. As organizations, supervisors, and community health worker allies, even as CHWs, we have to remember that we need to refill our cups. So as I mentioned, there is a lack of research on the effectiveness of organizations in providing support for community health workers. The decrease in renewal rates can be attributed to a number of factors, some of which you've already mentioned, and I think you already touched on all the ones I have listed here. But again, training cost, availability of training. Someone also shared that there's not enough CE credits. The application process is not clear. Availability of professional development, access to computer, internet. I mean, this past year, everything has been virtual. And so do our community health workers have internet and computers where they can attend these trainings? Transportation, language. We know we have community health workers from different backgrounds, different language needs. Again, time, childcare, grant funds, and yes, we know community health workers are often compensated with grant funds. Yes. And so community health workers provide support and advocate for their communities, But community health workers need the same, if not more support to be effective in their roles. A number of organizations exist at the national, at the state, and local levels to provide support and guidance to community health workers, instructors, and stakeholders. The organizations providing support include, and some of you may already be familiar with these organizations, right? At the national level, we have the American Public Health Association Community Health Workers section. We also have the National Association for Community Health Workers, great resources. In Texas, at the state level, we have the Texas Association of Promotores and Community Health Workers. We also have the Texas Public Health Association, which has a community health worker section. And again, in Texas, we have our advisory committee that's at the state level. And then we have regional training programs and organizations to provide this support. Do any of you belong or participate in a national organization for community health workers? So some of you are saying no. And so I would encourage you to, even if you're not ready to become a member, I know with NACHAO, the National Association, you can just subscribe to their website and get updates on anything new that they're doing. So you don't necessarily have to become a member and pay the membership fees, which there are added benefits that come with that. But if you just want to stay up to date, you can join that. You can subscribe to the website. So 70% of you said no, and 20% of you said yes. And 10% of you said not yet, but you will sign up. And so I'm glad to hear that. And again, you don't necessarily have to sign up as a member if you're still on the fence. Sign up for their listservs. What about in a state association or a state community health worker organization? Yeah, so some of you are saying yes. But again, the majority of you still say no. So not every state has an organization. That's a really good point. So some states have state organizations, but not local associations. Some places have local associations, but not state associations. In Texas, our 11 regional organizations have been in existence far longer than the state association. But all that took was some community health workers getting together and said, you know, we need a unified voice at the state level. Let's get a state association started. And so for those of you who maybe don't have a state association, maybe this is your calling to get that started. So again, national and statewide organizations are great sources for information for community health workers and can keep you up to date on what's happening across the state or across the country. There's a lot of policy advocacy happening. States that I know in Texas, there are some bills on the floor trying to get reimbursement for community health worker services. That's a battle we're still fighting. And so the one way to stay up to date on that is being involved with these state organizations. But regional organizations are in a very unique position to play a significant role in the professional development of community health workers. They can meet the distinct needs of CHWs for that specific region and hopefully help address some of this high turnover that we're seeing. because maintaining a skilled community health worker workforce is so fundamental to their role in addressing the needs of individuals in the community. So there's a clear need to assess the needs of community health workers and to provide guidance to organizations to ensure that they're being met. And it's also just as important to determine if community health workers are satisfied with their organizations, because it's almost pointless to have an organization if community health workers are just they're not feeling it, they're not satisfied with what the organization is doing for them. I do see that some of you are sharing those associations in the chat, so thank you. Yes, please share the resources that you have in the chat so we can all get connected. So in order to answer some of these questions that I had and to help me understand whether community health workers were satisfied with their organizations, I used two different tools. I used a survey. It was a web-based survey that was developed based on some of my research as well as some existing literature on organizational effectiveness. And they were disseminated to both community health workers and instructors across the state of Texas with the help of the advisory committee. They were available in English and Spanish, and I had about 353 community health worker responses. I actually had more responses, but I only used those that were, for the most part, completed, because some started and didn't finish it, and so I really only used those that were mostly complete. The interviews were used to provide additional context, and they were conducted via Zoom and phone, and in English and Spanish. So participants of the study really reflected the demographics of the community health worker workforce in Texas. So according to the 2019 DSHS report, 65% of all community health workers in Texas were Hispanic, and in my study results, 64% were Hispanic. Same African American, it was about 21% in the state identify as African American and 18% in the study. And so the trends were very similar. Women also made up most of the study participants, which we know also reflects the females in the CHW workforce. In addition, most of the participants identified as community health workers. We did have some instructors, some who self-identify as promotores. And that's also important to keep in mind, that we do have individuals who may not have that certification behind their name, but they are promotores. And we also had some that were expired community health workers. Of the respondents, 70% said they were employed full-time. However, only 63% of those worked as CHWs. And I think that goes along with some of the things that we've already mentioned in the chat. The lack of opportunities, the pay rates for community health workers, to where a lot of the work is actually done as volunteers and not as full-time employed community health workers. 59% of the CHWs were not affected by the pandemic. And so that's a question I added because this happened to be during the pandemic. 20% did experience a reduction in hours and 11% were furloughed, which again, we don't know necessarily if that was in their CHW role or just in general, if they were employed and were furloughed. About half spent time as volunteers, which again is pretty common for community health workers. But unfortunately, most of them were not able to continue volunteering. A lot of them experienced a reduction in hours, which is very unfortunate because, I mean, and this is a whole nother conversation about community health workers in the COVID response, right? That says a lot about how underutilized they were, or they have been and continue to be, as someone mentioned in the chat as well. So some results from non-members. Of the individuals who were not members of an organization, 62% said they didn't know, or if there was an organization. So very, very similar to what we saw here in your responses. Only about 32% said they did know there was an organization. So again, I wasn't surprised by your results. 20% they said they had been a previous member of an organization, which is interesting because now we need to know, why did they not renew their membership? While 78% had never been members, and 72% they said they would be interested in joining an organization in the future. So for those who were non-members, they were also asked to identify what would motivate them to join an organization and what would be some barriers to joining an organization. And they identified, for the most part, networking opportunities as a motivating factor, which is very true to the heart of community health workers. And at the same time, unfortunate that this past year, we were not able to do that very often. Apologize. Some of the key barriers were that they were unaware of a local organization. And again, that's exactly what we just saw here. Maybe also the dates and times of meetings, the locations. And so there are some barriers, but we can see that there are more motivating factors. So now when we look at members, the members were asked to assess their level of satisfaction with their organization, also the quality of the member benefits, their level of engagement, and the likelihood that they would renew their membership to the organization or even refer the organization to somebody else. And of the members, when we asked how did they hear about the organization, you'll see that for the most part, it was recommendations from up here. And we know that that's, again, true to community health workers, right? Word of mouth. That's how we get our information out. The majority of respondents had also been members of organizations for less than 5 years. And only very few had been members for over 10 years. So when asked what they would identify as major factors for joining a local organization, the top 10, these are the top 10 reasons that were identified. Notice how the top 3 are focused on professional development and networking. Again, going back to what are those motivating factors. The minor factors for joining an organization, and you may see here that the top ones include serving in governance or the prestige of being a member, having those top level positions. That's not necessarily what's driving community health workers to join. What they want is that what they really want is that networking and those opportunities to learn from other community health workers. They're not necessarily looking for the prestige of saying I belong to this organization. And also, just so you all know, I will be providing a summary report with all these results. And so no need to jot anything down. All this will be included in your handout after the presentation. So these were identified as not being a factor for joining an organization. And we'll see here that the reimbursement for membership dues or a employer recommendation, that was not a factor. That's not what's motivating people to join. Okay, so then I also mentioned that I conducted interviews with a smaller group of community health workers to really delve deeper into some of these questions, understand some of those, the root of those motivations and some of those barriers. And again, they were conducted in English and Spanish. There was representation from community health workers all across the state. So we had at least one person from each of the health service regions in Texas. And these are regions that are set by the Department of State Health Services. And so I did have pretty good representation from across the state. So when the interviews were analyzed, they revealed 5 key themes: member benefits, organizational support, attitudes, social identity, and organizational performance. And for each of these, community health workers shared some of their, some of the importance of each of them, possibly some areas for improvement, and even made some suggestions on how organizations can improve each of these areas. So as far as member benefits, community health workers really valued this. And this is something that we keep seeing. And again, something that you keep reiterating in the chat, right? Employment opportunities are important. So organizations that offer these benefits are very important. Educational trainings, whether online or in person. However, some area for improvement, as identified by the CHWs, was cost, timing, availability, and again, that availability of employment resources. As far as suggestions, CHWs did recommend that there's just a better availability or just bringing together more community resources so that they can have these resources when working with their clients or patients, that they have this toolbox of resources available to them. And again, networking opportunities with other community health workers. We keep seeing that also repeated throughout the results. As far as organizational support, participants really emphasize the importance of having an additional support system composed of fellow community health workers who can advocate for them, as well as provide guidance and encouragement and resources. Sometimes you just want to talk to another community health worker because they understand what you're seeing out in the field, can possibly provide you with some different approaches to address an issue. Some areas for improvement, we see employment resources again. And also another really important one was the lack of guidance after completing a community health worker certification course. So this was important because one of the main barriers is not knowing that there's an organization. And so some community health workers shared that after they finished their certification course, in Texas, we have a statewide certification course. So after they finished their course, it was like, okay, now what? Now where do I go? Now what do I do? And so they really felt like having some guidance as to what's the next step after becoming certified was very necessary. And so that is one area for improvement that I think we can all work together to improve. Another suggestion, more professional support advocating for more employment opportunities again, and providing mental health support. And I'm working on a whole nother project with providing mental health support as well. And so I hope to share some of that information with you all soon. So attitudes. This was interesting. Attitudes is really important. So individuals said that their attitudes towards an organization were shaped by their experiences, which makes sense. So if an individual interacted with a representative of the organization and they had a negative experience, they're not going to want to join. But if they interacted with someone who has had a positive experience, enjoys the organization, then they would be motivated to join. But it really seemed to be something important for them is those interactions, which takes us back to that networking. Some area for improvement, again, negative experiences can affect whether an individual continues participating. So making sure that we have that representation and having just a leadership that is positive and engaging with their members. Social identity was also important. We've talked about networking. So engaging with other community health workers is very important for professional growth. It gives individuals a sense of belonging and understanding to be surrounded by other community health workers who share your interests, who share your challenges. But an area for improvement was the availability of those networking opportunities. And again, that was a challenge in this past year, but it is something that we're all craving, that we're all missing. And someone shared that, unless you work with other community health workers, sometimes it's impossible to find them or interact with them unless there's a Facebook group or something available. And finally, individuals were asked to share what they perceive to be an effective organization. And some of the things that they mentioned was consistent leadership. And so one of the things someone shared was, there's always someone different. I never know who to contact if they say one thing and then they change their mind. So consistent activities, again, that supportive environment, an environment that encourages idea sharing without shaming, without judgment, and again, providing a variety of resources. So we're seeing similar themes over and over. So has anything that I've shared with you so far surprised you or stood out to you? And you can either respond in the chat or you can text that and so someone said consistency is important. Great. Okay. So thank you. Yeah. So so some of you have saying, nothing really has surprised me. And you're right. I think among us community health workers and allies and those of us who work with CHWs, this is not surprising. We know this, but we don't know, but there was no information available, no concrete data. And so with this survey and these results, now we have that concrete data to make these arguments for the need for additional support. And so before that, it was more, I know this is happening. I've heard it from my peers. I know this is going on in our community, but there's no data backing it up. Well, now you have data to back it up. Yeah, so some of you were surprised on that the decline in renewal rates. Yeah. So, we do see a lot of community health workers that let their certification lapse, and it's interesting. Well, and I don't know that I would necessarily say that CHWs don't see the value in recertification. It's more so, I think, the opportunities that we're seeing for CHWs. But who knows? Maybe the reports from after this past year, last year, we'll see those increase. Okay, so now I guess the key question is, what now? What do we do with this information? Now that we have this concrete data, what do we do? And so I drafted some recommendations based on my findings. So we really need to conduct more organizational assessments to understand our members' professional and social needs. What are those? And again, those may differ. These were for Texas. They may be different for Ohio, for Michigan, for Massachusetts. They may be different everywhere. And so really organizations need to understand what those needs are. We need to identify the grassroots organizations, associations, coalitions across the state to really have a comprehensive list of the support networks for when we do have new community health workers. One of the things that came about during my discussions with CHWs was, oh, there is this other organization here, but they're just not registered with the state. They're not listed on the state website. And so then the question becomes, well, how is anyone supposed to know that there's this organization available if it's not listed anywhere? And so we really need to identify those grassroots organizations, have a database of our networks, our local networks, to make sure that those new CHWs, when they become certified, that they are immediately connected to other community health workers, that they find that support system. That kind of ties into the next one: increase recognition and visibility of existing networks, provide support to organizations to help ensure members' needs are met. Encourage collaborative efforts between existing organizations, create a platform for organizations to exchange strategies and seek advice. Some organizations, again, are very grassroots, others are more formalized, and so we need to help each other out. If the more grassroots ones want to get to a point where they're applying for a 501c3 so they can apply for grant opportunities, then we need to provide that support as well. And also strengthen partnerships between training centers, organizations, employers, the program office, to really increase the reach of community health worker organizations to other non-member CHWs. Again, it needs to, rather than working in silos, we have to work together to make sure to reach all our community health workers. I'll give you an example. The organization that I'm with in DFW, we have approximately 100 members, which is great, but there are also maybe 400 or 500 CHWs in the Dallas-Fort Worth region. And so we have to figure out, how do we reach those other 300, 400 CHWs? What are we missing? What are we doing? Or what are we not doing? Who can we partner with to reach those community health workers? So again, membership, and this is straight from the research literature, it's known, membership in a professional association is a fundamental element of professionalism, and it's necessary for occupational development. That's a fact, that's proven, that's in the research. The likelihood of a community health worker feeling disconnected and discouraged to continue as a CHW will probably lessen if they have that support along their professional career. There is a positive relationship between social identity, so identifying with a group and having that support, and certification renewal, as well as the relationship between behavioral intention, so your intention to renew and to join an organization, and renewing your certification. And these were also, I have a few minutes left, pulling back a little bit. So these results were only one part of my larger study. So the larger study proposed a framework to measure organizational performance based on member satisfaction. So the survey that I just reviewed really informed the development of this framework. And so what this framework does is it's to provide guidance to organizations on how to meet the needs of their members. I also looked at an organizational capacity assessment, and again, along with the member satisfaction survey. So there's a lot of work to be done in this area, and hopefully this is the start of a lot of work to be done as far as organizational support for CHWs. Again, there's a key relationship between member satisfaction and organizational effectiveness and certification renewal. And so we need to make sure we're identifying what those are and meeting the needs of community health workers. And then finally, I just want to share this one quote from a community health worker. Now, it was a Spanish interview, but what she shared was, she told me, I just want to thank you. I see a lot of emails come through the state program office, and this one really just grabbed my attention because it was an indication that someone cares about how we feel, about what we need as community health workers and what they can do for us. And so this really stuck with me, and I've carried it with me. And I think this is what really has been my motivation to continue this research and continue working on papers and to publish, because we need to get the word out about the effectiveness of community health worker organizations. Are there any questions?
Wow. Wonderful presentation, Denise. I have a couple of questions that I've kind of pulled out of the chat that I want to make sure that we get to answer from everybody. I do realize that we are at time, so if you have to drop off, go ahead and do that. This recording will be available in like the next 1 to 2 hours. But if you can hang in there with us, we'll get through some questions. We've got to do the daily giveaway, and I have about 2 minutes worth of housekeeping notes that I want to go over as well. Denise, it was so hard not to talk. I wanted to jump in and say so much because it was such good content. Great presentation. One of the questions that Cynthia posed this, and I thought this was a great question, as you and I are both CHWs and have higher level degrees, but she says there's so much competition now with everyone wanting to be CHWs that also have other degrees that it's difficult to get a position. What are your thoughts about that, and maybe some recommendations for Cynthia and others that may be in her similar situation?
Yeah, that's a great question, because we are seeing that. And one of the things that I always try to remind potential employers is really the true model of a community health worker, what that is. Not to say, when I started as a community health worker, I didn't have my master's, I didn't have my PhD. Those came later, because the true nature of a community health worker is to serve their community. So it's not to say that you can't have both, but it really, I think it would really depend on what the work that the organization is trying to do. If you're trying to be more at a higher level, administrative level, supervision, then are you really looking for a community health worker, or are you looking for something else? If you need someone to be out in the community working with your patients and your clients, then maybe that's where we need to look for a community health worker. But I don't think it really matters what the degrees are. I think employers really need to think about what they want to do. And so one of the things that we really try to do as an organization is talk to employers about that. What is it that you're trying to do? And who is it that you need for that position.
Great, great. Someone else said, do you recommend, this is for Hannah, do you recommend we join national, state, and local associations?
Yes. Yes, because they each provide you with different resources, and hopefully are all working together. I know here in Texas, our association at the Dallas level, we're affiliated with the state association. So that is not a competition. We're working together. We encourage our members to work together. The state association can provide a different perspective, whereas the Dallas Association is more focused on what's going on in our regional level. But it's important for you to know what's going on at the state level, especially when it comes to advocating for reimbursement, because that affects us all. And so knowing what's going on at the state level is also really important.
Great, thank you so much. There were some other great questions today, but I'll take some of those and save them for the live Q&A tonight. I'll encourage everybody to come back tonight. It's going to be short, about 30 minutes, but we're just going to knock out a lot of the questions that you've asked today, as well as some other questions that you may have as well. So someone says, how can we sign up for the Dallas organization? And I know that's where you're at, so I'm going to let you go ahead and answer that one, Denise.
I'm going to type in the chat. So here's also my contact information if anyone needs to reach out to me. Again, the summary of this report will be provided to you all, but feel free to reach out if you have any questions.
Awesome. Thank you so much for your presentation. It was absolutely phenomenal. I'd like to do the daily giveaway now. I'm going to take the screen away from you. Let's see if I can get it here. Before I do the daily giveaway, let me go ahead and just mention a few things. Please log in early. Of course, we had some technical issues. It's always going to happen in the virtual environment. I was completely prepared for it. Please log in early. What I'm going to do from now on going forward is just email the live link, the link to the daily Zoom every day. Make sure you're using the email you registered with. So that's been a lot of confusion this morning. Some people registered with a personal Yahoo, and thought they did it with their job and vice versa. So make sure it's the email you registered with. The recording will be made available. You'll have it within the next couple of hours. You'll be able to advance through the video and complete the evaluation survey. So don't worry about being marked for your attendance and getting your CE. That's not going to be a problem. And also, please check your spam and junk folders. You might be getting emails from Umemba Health LLC. You may be getting it from the Thinkific platform. It's called Umemba Health Academy, but it is the Thinkific platform. So make sure your emails are not going there. So let me go ahead and show my screen. Let's cancel that down. I want to show you what the drawing is going to, the giveaway is today. So if you can see on my screen today, this afternoon, there'll be another drawing later this evening, but we're going to be spinning the wheel for this book just recently released, Promoting the Health of the Community Health Workers Describing Their Roles, Competencies, and Practice, as well as a $50 gift card to the UH Academy Merchandise and Apparel online store. So I'm going to be using something called Spin the Wheel. Let me stop my share there and find that screen. Sorry, I should have had that pulled up. Everyone that pre-registered, there were people that were signing up once we started. You're not actually included in this, but everyone that registered before we actually started at 12 o'clock, you are included in this. So I'm going to go ahead and spin the wheel now. If you are the one that receives the giveaway for today, you will get an email. So if you're not present, don't worry about it. So let's spin the wheel now. I want to make sure that y'all can see my wheel. Let me see. Can you see the wheel? Can you see the wheel? Someone say yes, you can see the wheel. You can see my screen. I don't want you to think there's any cheating or any. Okay, great. Awesome. So everybody can see the wheel. Let's go ahead and spin now. Is today's winner. Cynthia, you're going to be getting an email from me I want to thank you all for your time and your attention today. Thank you for hanging with us. I know we're a little bit over time. Look forward to your questions, comments, and feedback about the rest of the presentation today. Don't forget to post a selfie, post a business card, engage with us on the virtual photo booth, visit all of the exhibitors, go and follow them, find out how you can partner with those organizations, and join us here tonight at 6:30 p.m. Central Standard Time for the live Q&A with the instructors and presenters from today. Take care. Have a great rest of your day. Recording.